Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level.
Hey Vet Rehabbers, if you have not already been to watch the Vet Rehab Summit recordings, please make sure you schedule this into your diary. Please also make sure you download your CPD certificates. A big shout out to Sonia Evers for sharing a Facebook post about the Veterinary Rehabilitation Podcast. Sonia, please email me on meg@onlinepethealth.com. I would love to gift you with a limited edition Veterinary Rehabilitation Podcast mug. Now, if you guys are on Facebook, please come and join us in our online communities. We have the Small Animal Vet Rehabbers, Hydro Vet Rehabbers, our Equine Vet Rehabbers, and the Business Vet Rehabbers. Now, this is where all the Vet Rehabbers hang out online, share research, tips, and advice. And it's a really, really great supportive community. We'd love to have you there online with us. If you're looking for the links, I'll put them in the description. This week's podcast was so jam-packed with gold nuggets, we decided to split it into two parts. I speak with Sarah MacKeigan. She is the founder of the Facebook group Living with Dogs with Disabilities, and also her practice, Upward Dog Rehab. Sarah and I talk about degenerative myelopathy, the changes in our understanding of the condition, and how we can best treat it. We also discuss the internal versus external approach to treatment, and how we can combine them with diet, oxidative stress, physical stress, and balancing the right amount of exercise, and so much more. Before we head over to the chat, I just want to say a very quick word from our sponsors. Choosing the right therapy laser and PMF systems for your practice are big decisions, and that's why Response System has been helping to make that decision easier for over 35 years by offering both Class 3B and Class 4 lasers, as well as a full line of PMF products designed for both small animals and horses. All their systems are fully rechargeable and adapted to international grids. You can find out more at responsesystems.com. All right, over to my chat with Sarah. Hey everyone, thanks so much for joining us. We are live today with Sarah MacKeigan, and we're talking about degenerative myelopathy. Sarah, it's so awesome to have you online with us. I think the last time I was on a podcast, we did a podcast, you and I. Great to chat to you today. And I know this is a topic that you are so passionate about. This is your thing. So yeah, I'm excited to chat today.
Well, I'm really excited to be here, and it has been a while. I'm trying to remember. And I think we did talk about DM when we talked before, as well as some online stuff, but it's been a little while. So thank you again for having me. And yes, it is an area that I'm particularly interested in. I want to say interested is probably not the right word. Somebody asked me recently why I'm passionate about helping dogs with significant injuries and disabilities that they may or may not recover from. And in this particular case, sometimes you choose your path, and sometimes your path chooses you. And I think in this case, my path chose me as far as degenerative myelopathy goes. So yes, it's definitely something I want to get the word out there on, and hopefully help more pet parents and more professionals learn about what they can do to support these dogs and these pet parents. I say pet parents, some people say owners. My clients are pet parents. To really help them, because I know that you've recently also had Dr. Marsden on, and Debbie Taraka's, has her laser protocol, and there's new research coming out on ALS all the time. So we know that there is actually things you can do to help. There's always something you can do.
Yeah, and we're going to dive deeper today. So looking forward.
Thank you.
to picking your brain today on all the things about degenerative myelopathy. So, Sarah, do you want to start off with telling the listeners and everyone that's here live or listening to the replay exactly how you got into this field and a bit about yourself?
Sure, absolutely. I would love to. So first of all, I'm in Nova Scotia, Canada. So I'm across the ocean, up and across, I think, from where you are, Meg. But I am a licensed PT. So in Canada, we say physiotherapy. I'm a physiotherapist. And I actually came into canine rehab very intentionally. Sometimes PTs will discover canine rehab through their own human practice. When I had my beloved Sammy, who is, I'm just going to pull up a photo over here because she was really my heart dog. And the reason I got into this field, she had originally tore cruciate ligaments in her knees. And through that rehab process, there was actually another PT that was mentoring the rehab vet. And that's when I discovered that physiotherapists could go down this path and work with animals. And I did what every sane person does. I gave my notice at work, quit my job, sold my house, and went back to school. Literally in my 30s with people that were like 15 years younger than me. But I really felt like it was the right path for me. It just brought everything together. And that's how I originally started. I went on to do, in Canada, we have a diploma in canine rehab through our animal rehab division. So that was the next step that I did, and founded my own company called Upward Dog Rehab. And, it evolved from there. At that point in time, and we'll probably get a little bit more into this possibly, but Sammy did begin to develop weakness in the hind end. She was a German Shepherd, so there was, they're predisposed to just about everything that's a problem with dogs in terms, especially with spinal, hip, all of those issues. And originally we thought it was, and again, I was very new at this time, that it was more of like a lumbosacral issue. She did have osteophytes on, L6-7. We had seen those on x-rays, and then another vet had seen her and thought that it was presenting more like DM. And hopefully we can talk a little bit about what that looks like. And that was my introduction to living with a dog with degenerative myelopathy. Sammy taught me a ton through that process. And I think that this is where I say your path chooses you, because I was blessed enough to have a lot of people within my life that were able to fill in the gaps and teach me things that I didn't know about caring for a dog that has a neurodegenerative disease, and how to keep her as healthy and as active and provide her with a good quality of life. Because ultimately, if people are keeping their dogs when they have these conditions, they need to be able to take care of them and provide them with a good quality of life. And, we've evolved even more from the times I had Sammy, but these people in my life were able to educate me and teach me, and we were able to provide her with the care and the learning. Sam lived for almost 5 years from point of clinical onset, which is almost unheard of, really, because we know that with DM, most people will not keep their dog. The symptoms begin to present, and paralysis usually sets in somewhere between 6 and 12 months. And that's often when people choose not to keep their dogs anymore, and euthanasia is discussed. So Sam definitely bypassed all of those sort of typical milestones. She did pass away in March 13th of 2020. Do you remember that year? That was a great year. That was the year of COVID. So we went into lockdown 4 days after Sammy passed. Sure. And working through that grief, and then also being not able to work with my clients, my human clients or my canine clients, because of lockdown, experienced a lot of what, I'm sure a lot of people watching have also experienced. But I also saw a lot of struggle online. And I know you and I have connected on this a little bit in the past as well, but just seeing a lot of the misinformation that is online, and people struggling in the veterinary world, and the vet struggling to be able to care for these animals. And I wanted to do something. And that was the birth of Living with Dogs with Disabilities, which is a Facebook group that I created that's all about what you can do to help dogs with different injuries and mobility challenges, and to get content and information that you don't necessarily have to sift through. There's not, it has a really strong educational component. And I do a lot of live streams and interviews, as you know, in there, and it's all about what you can do. And I've just evolved and stayed on that path with DM in particular, but also DM and other dogs with neurologic conditions as well, because through my own practice, I've learned a lot. I'm curious actually if you've had this experience, because I know you're online a lot, but I've learned so much from that community and how everything is different. Sometimes I feel a little bit isolated, over on the East Coast of Canada all by myself, but I've learned so much from the people online and what they're experiencing and what resources they have available. And it became very apparent to me very quickly that there wasn't a lot of resources, especially for significant neurologic conditions like DM, but also other ones like IVDD, FCEs, all of these acronym neuro conditions. A lot of people are struggling they're combing the internet. They're told, let's say, even with disc disease, their dog she's not totally leaving, by the way. She warned me she was going to cough.
The dog needed to go out.
Where's she going? I'm making her upset already. No. But where I was going with that is there's so many people that want to help their dogs, and they're told basically at the onset of a diagnosis that's dire, like DM, and I use the term diagnosis loosely, or if they have a dog that, suddenly becomes paralyzed or just has a slow progression into that area, that there's nothing they can do. The dog's too far gone, the dog is old, and all of these things. And people want to do something, but they're told they can't do it. And then they end up having to go through this really laborious looking for information on how to help their dogs. And I just really feel, and I've seen dogs come into my clinic that when I first talk to owners online or like on the phone, that are told their dogs are not going to walk again, and they can either do surgery or euthanasia is probably the next best option. And these dogs are completely paralyzed. And sometimes by the time they even come into the clinic to see me, they're walking again. And I think that my big message, I guess, and I'm kind of starting it out with, but it really has evolved from what I learned through Sam and DM and the work that I've done with others online, to what I'm seeing is a lot of people want to do something. All these dogs, if pain is controlled, there's always something you can do, because every dog deserves a second chance at leading an active and fulfilled life despite injury or illness. And when the owners or the pet parents are committed, they deserve the opportunity to be empowered and supported to care for their dogs, regardless of whether or not they're going to walk again, because that alone does not dictate whether or not the dog can lead a good life if you know what to do. So that's my evolution.
So let's backtrack a little bit.
Sure.
And can you just maybe explain exactly what degenerative myelopathy is? So what exactly are we dealing with when we have a patient that has been diagnosed with that condition?
Well, I think we should be careful even backing up there with the whole diagnose, because I do have some slides that I might get you to kind of pull in and out of. But I want to start with that DM is typically it has a certain clinical presentation, which we'll pull up the slides for in a moment, but it also has, the only way to know for sure if a dog has DM is post-mortem. So we're looking a lot at that diagnosis of elimination and the clinical presentation. And I really do think that a thorough neuro exam is really a necessity with these dogs. And the other thing that I encourage a lot of people to do is to do the genetic test to look for the gene mutation, because DM does have a gene mutation, the SOD1 gene mutation. And if that's not present and you do that test and it's not present, then you're looking at something different. And as we're going to get into today, the way we work with dogs that have DM and other neurologic conditions is actually quite different. So can we come in? Because I just want to talk for a moment about what DM looks like so people have a sense there, and then what is actually happening in the body for these
Can I
dogs.
pop your slides up?
Yes.
Yeah.
So basically, degenerative myelopathy, I think it's really important to consider the fact that it does happen in older dogs. I've had some people, and I see this online a lot, where they're told their dog is DM and then the dog's like 2 or 3 years old. It's not DM. DM, one of the classic presentations is later in life, older dogs. They get this proprioceptive ataxia, which means basically that it's kind of like that drunken sailor walk, which is affecting their pelvic limbs first. One of the other classic signs associated with it is that upper motor to lower motor neuron. And basically what that means is you're going to see more like spastic kind of presentation in the pelvic limbs potentially, before you see those lower motor neurons where you see a lot of the weakening and more, leading into that paralysis. So it's more of that upper motor to lower motor, which is also, on the human side, it's analogous with Lou Gehrig's disease, or ALS. About 10 to 20% of people with ALS actually have the same genetic mutation as DM, and the presentation is very similar. Other things that come up: asymmetrical weakness, lack of spinal pain on palpation. And I want to be careful with this one, because I think that pain in dogs with degenerative myelopathy is missed a lot, because it's just assumed they don't have pain because the disease degeneration itself is not painful. And I think that actually leads to a decline in mobility much faster, because your dog doesn't want to move if they hurt. A few other things here. We talked a little bit, and we'll talk a little bit more about the SOD1 gene mutation. So SOD1 is superoxide dismutase. It's actually an antioxidant enzyme, but the gene responsible for the enzyme is where the mutation exists. One other thing here is there does seem to be a breed preference for DM as well. I didn't throw that slide in here, but we see it in our boxers and our corgis and our shepherds and our burners, those types of dogs. It doesn't mean it can't present in other dogs. It's just has a higher prevalence in certain breeds. I'm trying to get to this next slide. There we go. So DM does have typical stages of progression. So this is, if there was no intervention and we were looking for a dog at the time of onset, it's slow. I think that's the other thing that people should recognize when they're wondering if a dog comes into their clinic, whether or not this is degenerative myelopathy, is if this dog could walk yesterday and can't walk today, that's not DM, because it's a slow progression. I mean, you see this proprioceptive ataxia on the hind end weakness. Eventually that will lead to paralysis, and it does move forward in the spine. The front limbs begin to show the same symptoms as the back end. And if a dog was actually kept alive throughout all of the stages, they would tetraplegic, and it does actually impact the brainstem, which is something people should be aware of, because obviously at that point it is life-threatening. Brainstem takes care of a lot of those vital functions, as people know. So the big point here is it goes back end to front end, and it is a slow progression. And there are some symptoms that will also show up later on that are impacting the brainstem as well.
Sarah, so with
ahead.
that progression, I think back to practice now, the cases that I saw and I treated, and obviously the way in which they were being treated was all very different, with regards to what food they were being fed and the supplements. So nothing was constant there. But what I did notice is that some cases progressed a whole lot quicker than others. And some had like quite a fast progression to a point, and then stayed like that for 1 or 2 years and then started to progress again. Is that something that you found? Like, sort of differences in progression when some
Yes.
actually, for whatever reason, and I'm sure we're going to talk about this a little bit more, but there's obviously maybe something in which the owner was doing or something they were giving, or whether it be a supplement or food or something like that, maybe halted
Yeah.
it and slowed it down in its progression.
Yeah. Can we jump out and jump back in for a second, Meg? Is that okay?
Yeah.
I absolutely agree. So again, if we, without any sort of intervention or course of action, or just following kind of a standard, there's the Kathman physical activity article, and we know that PT makes a big difference. We know it on the human side, and then there's some newer research coming out on both the human and the animal side related to how we treat DM. But let's say we're not doing a lot, or even if we are, but maybe it's working kind of so-so, it does tend to kind of, plateau and then decline, and then plateau and decline. And I always tell people, status quo, like this is a really important thing for practitioners. Status quo is good. It's really, really, really good. As rehab professionals, we're looking for improvements, and this is a little bit different. This is about keeping what we got, if possible. And there are things, and we're going to get into this a little bit, but we know through the disease process, and we'll talk about this a little bit, but there are certain things that will create more stress in the body, more inflammation in the body. And those things, like, heavily processed foods, a lot of medications, pollutants in the air, high intensity exercise. There's different things that actually potentially injuries, other injuries, which is very common because we're dealing with senior dogs, that are all potentially can exacerbate or accelerate the disease. And it's something at some point, and this is where I know there's talk about preventing. I do a lot of air quotes. I'm just realizing that as I do this, but disease prevention. And I think it's a really interesting topic related to DM, but we do know that there's, things that will accelerate, and, but we don't really know the exact reason why, because some dogs can carry these genetic markers and never present with DM. Why? Right? There's a why. And I've thought that, and with my personal case, I think Sam had spindle cell sarcoma. She had her knee injury, then she had spindle cell sarcoma, and then she started to present with DM signs. And I think that there were those trigger things, something that turned on that, more intense inflammatory process that brought that mutation to life. But if we want to jump back into the slides, I can talk a little bit more about why that might be happening, where they're jumping in and out. Really quick as we go through this, and I just cut and pasted these slides. We can go back to this, but I did want to mention that there are a lot of other conditions that look very similar to degenerative myelopathy, and often they exist at the same time, which can make this a little bit more confusing for people. But I think it's really important to consider, because when we're working with dogs and owners of dogs with DM, that we're not just treating the disease, we need to look at the whole dog and everything else that's going on there. We can come back to this, but I actually did find as well, I was listening to one of your previous, I think it was your live stream with Dr. Marsden, Meg, and you had mentioned that it was hard to get the genetic tests where you're at. Now, this is in the UK, but there are some places, more places that are offering that test now than before. Okay. Yes, and I am going to say a few things that probably are a little bit different than the way we have originally thought about degenerative myelopathy. And I've spent a lot of time looking at DM, working with Dr. Marsden, looking at other researchers out there, and also looking at the human side at ALS and what is being done in that field. And often in that field, they are working with animals that carry the SOD1 gene mutation. So it really does, what helps DM helps ALS, and what helps ALS helps DM. But backing up here, some of the things that we know that might answer your question there a little bit, Meg. First of all, DM always occurs between T3, L3, that thoracolumbar region, which is also impacted a lot by a lot of other conditions. It is the narrowest, if you think of the spinal column and the spinal cord, it's where there's the least amount of space between the column and the cord. So there's this kind of opportunity for constant micro trauma. And it's also the area that tends to stiffen quite a bit as our dogs age. And it's not as, the blood vessels feeding that area are not as vascular. So it does more susceptible to poor blood flow, ischemia, those types of things, which leads to this thing called oxidative stress. And I know you have seen this before, but I think it's important to kind of touch on this because DM is often thought of as degenerative myelopathy. The myelin is degenerating. And people aren't necessarily even making the correlation with the SOD1 gene mutation. And it's actually there's a lot more that's going on within there than just the demyelination by itself. Basically, the way I like to kind of look at it or talk about it is really looking at this idea of the oxidative stress that's occurring in the body. So oxidative stress is basically imbalance between free radicals, antioxidants. And I know this is a little outside the rehab kind of field, but if folks can stay with me for a moment. And it's this imbalance is telling the body to create more SOD1, because SOD1's job as an antioxidant enzyme is to get rid of free radicals in the body. And we're getting more of that within that spinal column or area. And it's upregulating the gene, the SOD1, essentially. The problem is it doesn't do its job. It doesn't get rid of free radicals in the body, and it creates something called excitotoxicity through a whole series of events that are happening. And basically what excitotoxicity does, you can kind of think of it, I do like the analogy of clogging up the pipes because it's creating all of these byproducts within the axons, within the nervous system, which are basically blocking that flow of information kind of downstream from, one axon to the next, those impulses. So you really, it's like, when your sink is clogged and you don't clean the gunk out, you just get more and more and more and more, essentially. But the other piece of this and it's taken me, if my profs knew that I was talking about anything neuroscience, now they'd be like, what? It's taken me a while to really wrap my head around this, which is one of the reasons why I wanted to explain it, because I don't necessarily come from a heavy neuroscience background, but I think it's really important to understand this, because this is the reason why we don't treat DM like IVDD or other neurologic conditions, is because we're getting oxidative stress, which is upregulating the mutated SOD1. It can't do its job to get rid of free radicals, but instead it's creating all of these byproducts within and clogging up those axons. But the other piece of this as well is that excitotoxicity is, there's something called astrocytes and glutamate. So glutamate is actually looked at a lot in neurodegenerative diseases. And what is happening here is it also hinders astrocytes, and astrocytes' job within the nervous system, part of it is to get rid of the extra glutamate, because glutamate is a neurotransmitter and it's excitatory. And too much of it is not a good thing. But with DM, we get too much of it in the nervous system, and it ends up killing more motor neurons. So we get sclerosis of the axons, we get demyelination or degeneration of the myelin, and we're getting motor neuron death. And that's all basically because of inflammation and this oxidative stress, and more of this SOD1 being produced. and you just get in this negative, I want to say this backwards cycle. And that's really where this is nothing like disc disease. It's totally different. Did that make sense? I'm not sure if I butchered my explanation of that or not.
No, it makes complete sense. So basically what you're saying is that due to the oxidative stress, we end up with high amounts of the mutated SOD1
Yes.
enzyme, and then high amounts of glutamate. And
Yes.
those two things basically cause the damage to the nervous system.
Pretty much. It's really, and this is where it was interesting for me when looking at the work that Dr. Marsden's done and the work that Debbie has done with Dr. Miller and the photobiomodulation study and some of the other information that's out there related to Lou Gehrig's disease, is it's all about, how do we inhibit as much oxidative stress as we can, like get rid of that inflammatory process, as well as how do we promote healthy motor neurons? How do we keep more of them alive? How do we reduce the stress in the body? Those types of things. So that's where I find it really interesting and a little bit different, because for the longest time it was that there was literally nothing you could do, and it was strictly about quality of life. And I think we need to make sure that we are always addressing the quality of life component of it. Absolutely, because that's definitely what it's about, but also understanding that there is more to this than just treating it like a chronic disease. And in fact, treating it like a chronic disease might actually make it go faster instead of slower.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Response System. Their sponsorship allows us to be able to give this podcast out to you for free. So go and check them out. You can go to responsesystem.com. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.